Hi everyone, my name is Brittany and I had open heart surgery 2 years ago. I'm making a 5-part series documenting my experience and what I went through because I want you to be best equipped and know what to expect when you go into your surgery. And there are a few things that if I knew then what I know now, I would change, and I don't want you to make those same mistakes. So grab yourself a cup of coffee and tea and let's get started. A quick backstory on my history with heart disease. When I was 18, I went into the doctor and he found a minor heart murmur. He said it would never get worse, but unfortunately, over the next 4 years, it got worse to the point where it was at a level 4, which is the worst it can get. He also said that if it were to get any worse, I would have to have surgery to either repair or replace my not working valve. To my surprise, my heart stayed the same for the next 3 years, but then in Christmas time of 2016, I felt something was not right. I went into the doctor and sure enough, he confirmed that I was at a level 4+, which means I needed surgery to either repair or replace the valve. I had mitral valve prolapse, which means one of my leaflets in my valve was completely dead. It wasn't working. It either had to be repaired or replaced because this resulted in a lot of chest pain, my heart stopping, and shortness of breath in my everyday life. Now my need for surgery is confirmed, and at this point, I went through so many more tests just to make sure nothing else was wrong so that there weren't any surprises when it came to surgery day. This included everything from blood work, stress tests, transesophageal echocardiograms, MRIs, and all of those pre-surgery appointments. For me, it took about 2 months to get through all of those, which means my surgery was scheduled for mid-March. After all of those tests are done, you're going to get to the night before your surgery, and you will have to follow a protocol, but it's pretty easy. It's just washing your body in a certain way and sleeping in clean clothes, but all of that will be easy and straightforward. Now it's time for the morning of. My family got there at the crack of dawn. I think we were the first patients there. And once you sign in and do some paperwork, they call you back to the pre-op room and you'll change into your gown and they'll start preparing you for surgery. Now, this time takes about 2 hours, and there are so many people that have tasks to complete that there is kind of like chaos around you. Now, don't get overwhelmed. There's just a lot to do in those 2 hours. So one person will be working on this hand, one person will be working on this shoulder, and someone will be asking you consent questions. It's just a crazy time, but there's a lot to do in those 2 hours. One of the big things that I remember them doing is putting my wrist catheter in. So your wrist catheter will go from your wrist to your elbow, and therefore it's not the most comfortable thing that they'll put in, but they'll give you numbing cream for it. And they'll also get it in through an ultrasound. So I remember him doing that, and I think the reason they put that in first is because they give you medication to kind of conk you out for your neck catheter. Now your neck catheter is very important because it goes straight to your heart, which means it's not the smallest of things. So it's held in by 2 stitches, but I don't even remember them putting that in because the medication that they give you is equivalent to drinking 2 full glasses of wine on an empty stomach. So I remember them putting my wrist catheter in, and then I also remember at the very tail end of those 2 hours, my family coming in and talking with me and saying their goodbyes. After I said my goodbyes to my family, I was rolled into the operating room, and you see the operating table there and everyone getting ready. So you'll scoot on to the operating table and lay down. And remember when I told you that there was kind of chaos around you in the pre-op room? The operating room is times 10. There are so many people doing so many things. I remember laying down there a few seconds, which felt like an eternity, with people just going crazy around me. And then those really big circle lights, like in the movies, come overhead. And the anesthesiologist comes next to you and he starts talking to you. He probably was talking to me to calm me down. I don't know if I looked nervous. I definitely was. But the last thing I remember is him saying something and then I was out. Thanks for watching. If you have any questions, please comment with them down below. I'm hoping to do a Q&A to answer those questions and to go over anything I missed. I also want to remind you that I'm not a doctor. I'm just sharing my experience with you, and I'm certainly not an expert in the medical field. Now, if you want to hear more of my story, let's head over to part 2.